Viewers, Klencin Topical Lotion 1%. Each ml contains clindamycin phosphate. Description: clindamycin phosphate is the ester of clindamycin or 7-chlorolincomycin, a semi-synthetic antibiotic. Clindamycin has been shown to have in vitro activity against isolates of Propionibacterium acnes. This may account for its usefulness in acne, depending on the sensitivity of the microorganism and the concentration of the antibiotics. Clindamycin can be either. Clindamycin has no fungal activity. The in vitro inactive clindamycin phosphate is hydrolyzed by phosphatases of the skin to active clindamycin base. Clindamycin activity has been demonstrated in cumdinol extract from acne patients. Clindamycin in vitro inhibits all Propionibacterium acnes culture tested. Free fatty acids on the skin surface have been decreased from approximately 14% to 20% following application of topical clindamycin. Following multiple topical applications of clindamycin phosphate at a concentration equivalent to 10 mg clindamycin per ml. Very low levels of clindamycin are present in the serum and approximately 0.25% of the dose is recovered in urine as clindamycin. Indications: Klencin Topical Lotion. Clindamycin phosphate is indicated in the treatment of acne vulgar. Dosage and administration: route of administration, topical, external use only. Introductions: for use, apply to 2 times a day Klencin Topical Lotion to the affected area. Contraindications: clindamycin phosphate is contraindicated in individuals with a history of hypersensitivity to clindamycin or lincomycin. Adverse reactions: reports of side effects with clindamycin phosphate have been infrequent. The following adverse effects have been reported with the use of clindamycin topical: abdominal pain, contact dermatitis, skin oiliness, skin irritation, and stinging of the eye. As is the case with each substance applied to the skin, an allergic reaction against each component of Klencin Topical Lotion is possible. Warning and precautions. Warnings: most antibiotics including clindamycin have been associated with severe diarrhea. Diarrhea and colitis have been reported infrequently with topical clindamycin. Therefore, the physician should be alert to the possible development of antibiotic associated diarrhea or colitis. Precautions: Klencin Topical Lotion should be prescribed with caution in atopic individuals. Patients with history of the disease of Crohn's and ulcerative colitis should be observed. Used during pregnancy, lactation, and in newborns. Safety: for use of clindamycin in pregnancy has not been established. It is not known whether clindamycin after use Klencin Topical Lotion is extracted in human milk. As a general rule, nursing should not be undertaken while a patient is on the drug. Please subscribe my YouTube channel Hussain Pharmacist. Thanks for watching. Allah Hafiz.